We take this opportunity to warmly thank them for proposing this session, and also to thank all the colleagues that are working behind the scenes to make these events possible and useful. Ana Paula Souza, leading on pollution issues in the environmental team of the High Commissioner for Human Rights, will be facilitating today's session. And before I hand over to her, I would just share some quick housekeeping rules. I would like to remind that the documents and the video and the summary of the event will be made available as usual on the webpage of this event. You have the transcript that is available in 100 languages as indicated in the slide. And you are also invited to post questions in the Q&A box throughout the event. If time allows, it will help feeding the discussion. If not, our experts today will also be able to answer some of these directly online. With that, Mrs. Souza, over to you.
Thank you, Diana. It's my absolutely honor to moderate this event today. Not only moderate, but also co-organize together with the Special Rapporteur on Toxics and Human Rights and the FAO and you, the Geneva Environment Network. We're here to discuss a pressing matter, the pervasive impacts of pesticides on human rights. While pesticides have played an important role in global agriculture, their unsound management has far-reaching implications for human rights, ecosystems, food security, nutrition, and health. Just to help us contextualizing better, some pesticides are so dangerous that they cannot be used safely under any circumstances, with an estimated 200,000 people a year dying from pesticide poisoning. This event is also timely as we prepare for the upcoming Basel, Rotterdam, and Stockholm Conventions, known as BRS, COPs, which this year focus on the unsound management of chemicals and waste under the very clever title of Making Visible the Invisible. Around 70% of the chemicals covered by Rotterdam Convention are treated that regulates the prior informed consent procedure for certain hazardous chemicals and pesticides in international trade are pesticides. Human rights law imposes specific duties on states to prevent, protect, and remediate environmental harm. The BRS conventions, together with the FAO's voluntary code of conduct on pesticides management, provide the necessary tools for managing pesticides throughout a life cycle approach, and in doing so, protecting human health and the environment against their harmful effects. Yet, the absence of a human rights-based approach is resulting in severe limitations to the application of these instruments. This is the core issue that our speakers will address today. Despite the widespread global use of pesticides in agriculture, the far-reaching implications of the unsound management of pesticides still remain largely invisible, with those in vulnerable situations, including peasants and rural workers, indigenous peoples, and persons with disabilities, and more, particularly at risk. Despite the risks associated with the use of pesticides, it has been commonly argued that it is necessary to increase yields to feed the growing world population. But at what costs? And who are disproportionately bearing such costs? What are the alternatives available, accessible, and affordable to feed the world in a healthier and more sustainable way for people and the planet? And what are the barriers preventing sustainable ecological alternatives to thrive? At today's event, we will explore strategies for integrating human rights into the Code of Conduct on Pesticides Management, including by fostering access to information, inclusive and meaningful participation of rights holders, while considering the impacts on human rights, with a focus on those most at risk and the need to ensure greater accountability for the mismanagement of pesticides. We have a truly stellar panel of not 1, 5, or 10, we have 11 speakers. For this reason, I would also like to ask panelists to be aware of time. Time allowing, members of the audience will have the opportunity to raise their own questions or views and perspectives on the issues that will be raised here today. But as Diana has already mentioned, you also be encouraged to write your own questions in the chat and Q&A box. But without further ado, I would like to introduce you to our first speaker, Dr. Marcos Orellana, who is the UN Special Rapporteur on Toxic and Human Rights. Marcos, pesticides pose significant threats to multiple human rights if not properly regulated and managed. As the Special Rapporteur on Toxic and Human Rights, how can a human rights-based approach to pesticide management reduce the negative impacts of pesticides while also strengthening the accountability of duty bearers for the harm caused by improper pesticide management? You have the floor.
Thank you very much, Ana Paula, for that question. And thank you for the organizers for their invitation to join this program today. I'm really pleased to have the chance to elaborate on some of the key elements of a human rights-based approach as applied to pesticide management. So a couple points. This morning in the 5 minutes that I have, 4 points. One is on the issue of people in vulnerable situations. A human rights-based approach calls for priority in policy and measures in affording protection to people that may find themselves in vulnerable situation. This means, among other things, that the burden of risk management should not fall on the weakest link in the value chain of food production. Ana Paula, earlier you mentioned that there are certain pesticides that are so hazardous that they cannot be safely managed. This is the situation of highly hazardous pesticides. These pesticides, under a human rights-based approach, should be phased out because personal protection equipment is insufficient in order to deal with the risks, and it also transfers the risks to the weakest party in the link. Much more could be said, but I would wish to highlight a second element of a human rights-based approach, which is the emphasis on discrimination or ensuring non-discrimination. And this brings in the issue of banned pesticides. And so those are pesticides that are banned in their country of origin, but yet allowed for production for export. Now, this is a modern form of exploitation. It brings in issues of shared responsibilities, however, between the exporting country that should put an end to these practice and the importing countries, which should provide protection to people within their jurisdiction. Now, it's often the case that it's argued that, well, countries are sovereign to decide whether to import or pesticides or not. But this argument ignores the glaring lack of capacity that is present in so many countries in the world, mostly developing countries, certainly, but also in industrialized countries, capacities to assess the proper risks or the risks of pesticides. And that's where the importance of multilateral environmental agreements such as the Rotterdam Convention come in. The Rotterdam Convention has been largely paralyzed because of the breakdown of the science policy interface and the lack of ability of the Conference of the Parties to follow the advice of its scientific body and list for control certain hazardous pesticides. It also brings in the importance of voluntary instruments like the Code of Conduct on Pesticide, the International Code of Conduct on Pesticide Management of the FAO and the World Health and the WHO, which is being reformed precisely to align with human rights issues, especially in connection with people in vulnerable situations like indigenous peoples that often bear the brunt of the impact of pesticide exposure. A third element in a human rights-based approach is the science policy alignment. Now, this has many implications, but one of them is research that is directed and tailored to providing protection to people in vulnerable situations, to people in the weakest link. So what research is being conducted to find alternatives and substitutes to hazardous pesticides? Another element is information on the scientific evidence, accurate information distributed in society that enables societies to adopt protection measures. And then third, of course, is protection measures. When science reveals risks, even when there are uncertainties, but where there's evidence of hazardous activity and potential damage, there needs to be restrictions, there need to be phase out. Often these protection measures are delayed because of disinformation in society, and that's where the science policy alignment does come in. And a final element is of a human rights-based approach as applies to pesticides is on effective remedies. This brings into focus the number of obstacles that arise in connection with an effective remedy. I'll be preparing and presenting a report to the Human Rights Council in September on effective remedies and access to justice. Just to mention a few: the lack of information, the burden of proof often posed to the weakest party, issues of jurisdiction, and the list goes on. But I'm out of time, so in conclusion, please allow me to restate that a human rights-based approach is key to strengthen the effective implementation of multilateral environmental agreements in the area of pesticide management. Thank you so much for your attention.
Thank you so much, Marcus. I'm always so happy when we start the event because you are so good in setting this comprehensive view of the problem. And thank you also for already reminding and emphasizing the need for phasing out all highly hazardous pesticides, dealing with the issue of double standards when a ban pesticides in the country of origin is allowed for export in another country. The important role of MEAs to kind of balance these issues of no discrimination within and between countries as well, and the importance of science policy alignment, access to information, protection measures, effective remedies. I think you've done it was a treat listening to your remarks. I'm now going to invite our second speaker of the day, Shaumali Guttal, who is a member of the Working Group on the Rights of Peasants and Other People Working in Rural Areas. Shaumali, rural workers are among the groups of people most affected by pesticides' negative impacts. How can the protection of peasants' right to safe working conditions and a healthy environment be strengthened in the International Code of Conduct on Pesticide Management? You have the floor.
Thank you very much, Anna. Can you all hear me and see me all right?
Yes, we can.
Okay, all right. Well, so thank you again for inviting me to speak at this event today. And it's a real honor for me to be able to speak with and share the floor with so many eminent and well-respected experts on the matter. So following up from the earlier presentation, I'd just like to emphasize again that human rights protections cannot and must never be voluntary in our collective commitment. In our collective commitment to a human rights-based approach. And an effective way to strengthen the rights of peasants and rural workers to safe working conditions is to integrate provisions in the United Nations Declaration on the Rights of Peasants and Other People Working in Rural Areas, UNDROP, of which the working group of which I'm a member, to integrate the provisions of UNDROP in the Code of Conduct, and then for states, UN agencies, social movements, and civil society to ensure implementation of these provisions. Now, Article 2 of UNDROP states that states shall respect, protect, and fulfill the rights of peasants and other people working in rural areas, that they will promptly take legislative, administrative, all appropriate steps to achieve progressively the full realization of the rights in the declaration that cannot be immediately guaranteed, which means that there is a lot of scope for states and all concerned actors to push further the ambit of human rights protection. Article 2, paragraph 4 also says that states shall elaborate, interpret, and apply relevant international agreements and standards to which they are party in a manner consistent with their human rights obligations as applicable to peasants and other people working in rural areas. And the Code of Conduct of Pesticides is an international agreement standard. Even if there is a term voluntary code of conduct, it is still an international standard. And so therefore, states can use the protections provided in UNDROP to strengthen this code. Then in the same article, paragraph 5 says that states will take necessary measures to ensure that non-state actors that they're in a position to regulate. And these include businesses, transnational corporations, enterprises, organizations, private individuals, to also respect and strengthen the rights of peasants and other people working in rural areas. So again, that means that states then have the mandate through UNDROP to be able to regulate the way pesticides are used, imported, stored, and so on, even if they are dealing with business enterprises and non-state actors. Now, there are two specific provisions on pesticides and harmful chemicals in UNDROP, which are extremely important to our conversation today. The first is Article 14. Now, Article 14 begins with saying peasants and other people working in rural areas, irrespective of whether they are temporary, seasonal, or migrant workers, they have the right to work in safe and healthy working conditions, to participate in the application and review of safety and health measures. And then I won't go into all the language of how this particular right is elaborated, but just some key points here are that they have the right to the implementation of measures to prevent, reduce, and control hazards and risks. They have the right to report unsafe and unhealthy working conditions and to remove themselves from danger resulting from their work activity when they believe that they are in imminent danger to their health, and so on. In the same article, but the second point, paragraph 2 says, peasants and other people working in rural areas have the right not to use and the right to not be exposed to hazardous substances or toxic chemicals, including agrochemicals, agricultural and industrial pollutants. And then it follows with the following paragraph, points out how, explains how states need to take appropriate measures to ensure favorable, safe, healthy working conditions for people, peasants and other people working in rural areas, and also in particular designate appropriate competent authorities responsible to establish mechanisms for intersectoral coordination for the implementation of these policies, and so on, which includes, occupational safety and health in agriculture, agro-industries, fisheries, provide corrective measures, and so on. And so these, again, show very clearly how governments in the Human Rights Council and in the General Assembly have agreed that states have the mandate to be able to protect peasants and other people working in rural areas, rural workers, regardless of their migration or legal status, from being exposed and subject to dangerous chemicals. One, and I know I'm running out of time, so I'll just finish up here very quickly. The same Article 14 also provides guidance to states by instructing that states shall take necessary measures to ensure the prevention of risks to health and safety. And then it goes on and explains a number. It points out a number of actions that states can take in terms of establishing national systems, public awareness, suitable system for safe collection, recycling, and disposal of chemical waste, obsolete chemicals, and so on. It also talks about what states can do to regulate those who produce, import, sell, transfer, and store chemicals, and so on. And the last point there is, of course, on the implementation of educational and public awareness and the issue of capacity building, which the previous speaker, the special rapporteur, already talked about. And UNDROP Article 14 specifically refers to these points. The other very important article, just in closing, is Article 18, which basically says that peasants and other people working in rural areas have the right to enjoy without discrimination safe, clean, and healthy environment. And states shall take appropriate measures to ensure that peasants and people without discrimination have access and enjoy a safe, clean, and healthy environment. And here again, there are a number of points. And so Article 18, paragraph 4 talks about how states shall take effective measures to ensure that no hazardous material, substance, or waste is stored or disposed of in the land of peasants and people working in rural areas, and will cooperate to address the threats to the enjoyment of their rights, and also from actions that result from transboundary environmental harm. So this is again extremely important, but because very often the danger that workers and local producers and fishers face is not necessarily from agrochemicals right there in their area, but also from quite a distance away, sometimes across national boundaries even. And Article 18, Section 5 again says that states shall protect peasants and other people working in rural areas against abuses by non-state actors, including by enforcing environmental laws that contribute directly or indirectly to the protection of the rights holders under UNDROP. So in sum, I would just like to say that UNDROP is a very, it's a new, not so new because it was actually passed 6-7 years ago, but it is a forward-looking instrument that brings in one, it brings under one umbrella a number of rights that are relevant for and necessary for the protection of peasants and workers and all people working in rural areas, and therefore they're extremely relevant for the conversation that we're having today. Thank you.
Thank you very much, Shavali. Thank you also for highlighting that human rights protections are not, they can never be considered voluntary. Those are obligations that states have assumed under international law. And then also for drawing the link so clear on how UNDROP should be integrated in the code of conduct as a matter of obligation, and also recalling that is an obligation of states, but business also have the responsibility to do so. I also encourage the audience to, if you're not familiar with the work of the working group on peasants and other rural workers, there is a link on the chat. It's also a relative new mechanism, and there is a lot of potential there. And we're all very excited to have you here, Shamali, to speaking on behalf of the working group. I'm going to ask panelists to be more strict with time. Everybody has 5 minutes because we need to make sure we get down to the last speaker on time. Otherwise, I'll be in trouble with Diana. So our next speaker is Juan Jose Echanove. He's the Right to Food team lead at FAO. Juan, the right to food is the backbone of FAO's mandate. How can the International Code of Conduct on Pesticide Management be strengthened to protect this right from the negative impacts of pesticide management? You have the floor.
Thank you. Thank you so much, Ana Paula. And yes, indeed, the right to food is the backbone of FAO mandate. And let me start by saying that this is not just a moral commitment. It is a legally recognized human right enshrined in the Article 11 of the International Covenant on Economic, Social, and Cultural Rights, and binding on 173 states to date, right? So this right is not an abstract idea, the right to food. It means that every person, everywhere, has the right to adequate food. And that means food that is viable, accessible, safe, culturally acceptable, sustainable. And it also means that states have an obligation to respect, protect, and fulfill this right, including from the threat posed by unsound pesticides management. And here lies the problem. Because when pesticides contaminate soil, water, and air, they don't just disrupt ecosystems, they undermine the resilience of entire food systems. They compromise the nutritional quality and the safety of food, and in many cases put the long-term sustainability, right, of food production at risk. So this is not a technical failure, it's a human right violation. And let me give you perhaps a few examples, real examples for us to get some concrete perspective of what we are really talking about. Like, for instance, in Guadeloupe and Martinique in the Caribbean, the prolonged use of chlordecone, which is a pesticide banned elsewhere, and Mr. Orellana was talking about this before, contaminated soil and water so deeply that exposure levels remain very high today. Thousands have been exposed for decades. And the result, according to many sources, is long-term damage to local agriculture and fishing communities, not to talk about the health implications and so on. Another very different example, in India, a very tragic incident some years ago in Bihar, where 23 children died after eating a school meal prepared with cooking oil stored in a container previously used for monocrotophos, which is a highly toxic pesticide banned also in many countries, but is still widely accessible. And in Costa Rica, just to mention a third example, aerial spraying over banana plantations has led to repeated complaints by rural communities about contaminated water, for instance. And these communities, often low income and also indigenous peoples, are being exposed to chemicals that, as already mentioned, are not even allowed in the exporting countries. So these examples, I guess, speak to a deeper systemic failure, because for too long, responsibility for managing the risks of pesticides had been placed mainly on end users, farmers, peasants, workers, communities, instead of where it belongs, on states. States, as Shamali already highlighted, have the duty to regulate, to inform, to monitor, and to protect people from harm, right? So let us not forget the procedural rights that are often neglected, and the right to participation, which in the case of indigenous peoples takes the form, of course, of the free, prior, and informed consent. The right to access justice, the right to be heard. Decisions on pesticides policies should be informed by the voices of those most affected, women working in the fields, indigenous farmers, rural youth, and so on. And this brings me to the International Code of Conduct of Pesticides Management, of FAO and WHO. And it is indeed a powerful tool. But today we must ask ourselves whether it goes far enough in protecting human rights. And I believe that to be truly safeguarding the right to food, maybe some key improvements are really needed in the code. The code, I believe, could be reviewed to recommend mandatory harm right impact assessments before any pesticide is registered or is imported. This could ensure that we are not just looking at chemical risks, but also at impacts on people's health, on livelihoods, on access to food. The code, I guess, should also prohibit the export of pesticides that are banned in the country of origin. And again, as Marcos Orellano already mentioned, allowing their manufacture for use elsewhere creates a double standard and violates the principle of non-discrimination, which is at the heart of international human rights law. And I also do think that the code should strengthen accountability systems and effective remedies, again, as Marcos also was referring to. And one way to do this could be by integrating in the code a recommendation for countries to establish independent grievance mechanisms at the national level so that communities harmed by pesticides exposure can report violations and eventually access justice. So let me finalize by saying that protecting the right to food is not an add-on, it is a starting point. So let's make sure that the code of conduct reflects that. And let's ensure that no one's plate comes to a price tag of poison or pain. Thank you so much.
Thank you so much, Juan. And I should, in the beginning, I just referred to the code of conduct as an FAO code of conduct. And we have a speaker from WHO. There was an oversight. Let me correct myself, the FAO and WHO International Code of Conduct of Pesticide Management. Thank you very much, Juan, for laying the ground so clear on how human rights are not a moral aspiration, abstract idea, and then how pesticides undermine the resilience of food systems, causing long-term harms as extensive as the ones that you have mentioned, and putting so clear that how this is a deep systemic failure and a human rights violation, and then we should call it for what it is. And also for bringing so very specific, very clear, very straightforward recommendations on how the code of conduct could be strengthened or improved to improve its protection, the protection of human rights, including through mandatory impact assessments, the prohibition of exporting pesticides banned in country of origin, the double standards, or strengthening accountability and access to remedies, including by integrating a recommendation for establishing independent grievance mechanisms. And yes, the right to food is a starting point. And so I thank you for sharing those reflections with us today. And I will move without delay to our fourth panelist, Ana Maria Suarez Franco, who is the Secretary General of UN International, a global human rights organization that advocates for the right to adequate food and nutrition. Ana Maria, UN has exposed corporate influence in pesticide management and regulation. Based on your research and advocacy, can you explain how that corporate influence operates in pesticide management and how this impacts people in situations of higher vulnerability? You have the floor.
Thank you very much, Ana Paula. It's really an honor to be here with all these panelists and to all the organizers and participants also. Thank you very much. This is a very difficult question, and we have been investigating a lot. And to mention quickly a kind of typology of how companies in the pesticide industries are influencing or capturing our societies and also the corporate spaces, I would like to mention the following. First, the agrochemical industries impose narratives that favor their vested interests, presenting themselves as the only solution and sometimes using science to support those narratives. And this means also excluding the solutions that the peasants' movements, as for example, agroecology, are bringing to the table. These companies also exercise corporate control along their value chain, exercise a lot of power, and this power is increased due to the different mergers. We have studies saying that the principal players, BASF, Bayer, Monsanto, Corteva, and Syngenta, exert significant influence over the entire supply chain, and I will put the sources here later. They also create dependency of peasants, and this connects to what Shalmali was presenting, because they provide some technologies and packages of fertilizers, seeds, pesticides, and then it is very difficult for peasants to cut the dependency that is created in cases, also including through creating debt, which is totally contrary to their food sovereignty. We see also how these industries are benefited by distortive industrial farming subsidies that they get in many cases advocating in parliaments. They also use corporate voluntary agreements to greenwash their exercise of their responsibilities, and this is very connected to a narrative of corporate social responsibility that avoids corporate legal accountability and liability. We see also the collusion between donors, pesticides industry, associations, in some cases the FAO, some parts of it, and governments and input suppliers, and the interference in our capture of regulatory spaces, for example, stopping regulations that are needed to protect the people and the planet, stopping also the favoring practices for the peasants that are proposing the other solutions, or really fostering regulations that are favorable to their interests. And FIAN has documented very well the example of a partnership that the FAO had with CropLife International. I will not have the entire time to explain this. Fortunately, all the work that the Stop Toxics Alliance, which has been led by PAN International, but with the participation of over 400 civil society organizations, achieved to stop this alliance. Nonetheless, we still see that at the FAO there are problems like the lack of real accountability and monitoring mechanisms for the affected communities, and we think that this should be included also in the FAO and any kind of regulation guidelines or binding regulations that they take. Also, I would also like to mention 3 cases where we saw how these corporations influence. One is in Thailand, where Bayer pressured Thailand to overturn its ban to glyphosate, also in collision with US officials. Also, Syngenta manipulated scientific data for decades to prevent bans on toxic weed killers, and in Mexico, Bayer and CropLife America lobbied the United States trade representative, leading also to dropping the bans of glyphosate, which is very problematic. Finally, I will not have too much time to go into the different impacts that happen when the regulation is not protective enough, but I want to say that the right to clean, healthy, and sustainable environment is very affected. Also, the right to health. And this includes also the poisoning of millions of farmers. And maybe in the discussion, I can go further also on the impact of women and the care work that they do. Thank you very much.
Thank you so much, Ana Maria. For bringing the narrative that has been imposed by the agrochemical industry, presenting themselves as the only solution, excluding solutions from peasants' movements such as agroecology to the table, and then how corporate control the power of controlling the entire supply chains and creating dependence of peasants and debt, which is contrary to food sovereignty. Also for mentioning like all these greenwashing practices, conduct that are aiming at avoiding corporate accountability and capturing regulatory spaces, all illustrated through several case studies. So thank you very much for sharing that perspective with us today. I'm going to now move to our fifth panelist, Dr. Tadisa Mera, who is an environmental scientist based in Ethiopia and the executive director of Pesticide Action Network Ethiopia, the international coordinator of PAN International, and he was also the co-chair of the International Pollutants Elimination Network, IPEN, for the last 6 years. He's best known for pioneering agroecology initiatives that model organic alternatives to eliminate highly hazardous pesticides used in the cotton cultivation in Ethiopia. Tadisa, what a pleasure to have you here today, and you have the floor.
Very much, Anna. Thank you so much, and thank you for inviting me to contribute this process. I would like to contribute to the impacts of these highly hazardous pesticides to low-income countries. The first one is, as has been mentioned earlier, the pesticides that are produced in the countries of origin, which are really banned there and exported to low and low and middle income countries, have different impacts. And it's not only from the health perspective. It has economic impacts, it has environmental impacts, and human health and well-being related impacts. If I start with the economic impacts, in developing countries, when these pesticides are being used and agricultural products are produced and exported to the countries where these pesticides are produced, if a small residue of these pesticides are obtained, they are rejected and they are shipped back. This is a very big economic disaster to these developing countries. These pesticides are not produced, they are net importers, and they use that, and after they produce these commodities, they are rejected, and this has a very big economic impact to the farmers and also to the governments. The second one is environmental pollution and also the negative impact on biodiversity. In the areas where in Ethiopia where we started organic cotton production before we started the project, there was aerial application of pesticides. In the areas, even in smallholder farms, we couldn't get pollinators much, and there were no honeybees around. But after we convinced the government and private sector stopped aerial application, and also we started agroecological approaches first, and then organic cotton production in these areas. In the cotton fields now, we can see many pollinators. And when you drive through that area, you can see traditional honeybee hives are hung everywhere. And you can see the production of honey in these areas, and very, very good forest honey that you can get. And the revival of the pollinators and honeybees is being seen. And the third one, with regards to human health impacts, the first impact is on the agriculture workers and farmers. The pesticide impact is first from the application. These pesticides are hazardous. These are created to kill, and humans are not immune to that. And in the African situation, the farmers cannot use protective devices, and as has been mentioned earlier, the protective equipments cannot save farmers because these are highly hazardous pesticides. And the farmers and their families are impacted by the application process, where the drift is taken up by their bodies and they become sick, and many farmers are also dying of pesticide poisoning. This is from the farmer side and the application side. But it doesn't stop there. The food that's produced has high amount in residue, and the farmers are eating that. And also it comes to the consumers, and the consumers are also eating that. If we see the right to food, it is the right to save food, not only, I mean, not just to eat whatever food we are getting. So the right to food is the right to save food, and the residues are also impacting consumers. And with regard to highly hazardous pesticides, the Africa region was a champion at ICCM5, and Africa really championed that, and we got that resolution to phase out HHPs and to establish even a global alliance to phase out highly hazardous pesticides. And in this process, PAN International pioneered this process, and also IPEN and PAN have that like-minded support to the Africa region. And we got also, with the championship of Ethiopia, we got that resolution at UNIA 6, and now the world has a backstopping policy to phase out these highly hazardous pesticides from agriculture. How can we phase out? Do we have approved alternative? Pan International in Africa through Pan Africa, in the Anglophone Africa, and in the Eastern African part, also in the Anglophone Africa, we have organizations working at grassroots level in Asia Pacific through the Pan Asia Pacific Regional Hub. We have grassroots work in that area, and in Latin America also through RAPAL, in different offices of RAPAL in Latin America. We have grassroots tested alternatives to highly hazardous pesticides without affecting the yield and without impacting the economy, and with a better solution to environmental pollution and without affecting human health. So these are the regions who have really ample knowledge, documented alternatives that can replace highly hazardous pesticides with tested agroecological solutions, and this can be promoted through different processes. And this is also ready for a contribution to the Global Alliance and also in implementing the Strategy 7 of the GFC, the Global Framework on Chemicals, so that we can promote the phasing out of highly hazardous pesticides from agriculture. For the sake of time, I stop here, and thank you, really. Thank you very much.
Thank you so much, Tadis. It's always so nice to hear from you. And thank you for giving such a comprehensive view of like the economic, health, human rights, social, environmental impact of pesticides throughout the life cycles, from farmers, rural workers, but also to consumers. I think we've been working together, or we met in the context of like ICCM5, the International Conference on Chemicals Management, where there was adopted also resolution that creates this global alliance on highly hazardous pesticides, and we are eagerly waiting for that to be launched as mandated by ICCM5 and then further corroborated at UNEA 6. And thank you for all your efforts, including the international level, to make sure that this becomes a reality, the phasing out of HHP. There are several questions, you just start touching on it, several questions on the chat coming from in relation to like agriculture, but also the impact of pesticides on biodiversity, for example. So I like to ask, because we may or may not have time to address those questions more in depth once this first round is over, if the panelists would like to share their thoughts in writing in the chat. I'm now moving to Larissa Mies Bombardi, who is a professor at the University of São Paulo, Brazil, and researcher at the Agroecology Laboratory of the Université Livre de Bruxelles. She is the author of the book Pesticides and Chemical Colonialism and 2 atlases on pesticides. Larissa is a member of the National Forum for Combating the Impacts of Pesticides in Brazil and a board member of the international organization Justice Pesticide and a curator of the International Pesticides Standard Alliance, IPSA. Larissa, bom dia, boa tarde. Your research highlights pesticide poisoning disparities in Brazil. Could you elaborate on these findings? And additionally, could you how can meaningful and informed stakeholder participation in decision-making processes affecting pesticide management lead to a sounder management of pesticides? The floor is yours.
Thank you so much, Ana Paula. Thank you also for the invitation. To answer the questions you are proposing, I would like to share some slides. I'm focused on Brazil, but I would like to highlight that Brazil is not an isolated case. Please, the next slide. So here we have a map about pesticides use per cropland area. As you can see, Brazil is the biggest consumer of pesticides. Please, the next one. And here we have the pesticide sales in Brazil in the latest years. As you can see, it increased 166%. I would like to emphasize that in the same period in Europe, it decreased about 0.3%. The next one, please. Here we have a chart about the top pesticides sold in Brazil, the 10 most sold. And the ones with this symbol of prohibited are pesticides banned or not allowed at the European Union. So it really shows clearly this double standard. Out of 10 pesticides most sold in Brazil, 4 are banned at the European Union. The next one, please. And just to give you an example of this impact or how this is so dangerous, here we have the case of atrazine, which is the 4th most sold in Brazil. Among many effects, we could talk, for example, about stomach cancer, prostate cancer, thyroid cancer, different kinds of cancer, and also malformation. That's why it was banned in the European Union in 2003. The next one, please. So here we have a map about the increase in the use of atrazine. As you can see, the region in which it most increased is the Brazilian Amazon. And atrazine is also considered as chemical castration. So it gives you an idea about the environmental impact also of the use of this substance in the Brazilian Amazonia. And considering that it's spreading in the water, the level of impact on the environmental impact is really big. The next one, please. And here we have a map about people poisoned by pesticides in Brazil. We had in the latest year more than 56,000 people poisoned by pesticides. But if we consider that for each case reported, we have 50 unreported, probably we had in this period more than 2 million people poisoned by pesticides. The next one, please. Even babies have been poisoned by pesticides, babies between 0 and 12 months old, which shows us the level of exposure. The next one, please. Women poisoned by pesticides, the next one, please. And pregnant women poisoned by pesticides. There is also this impact on the gender impact, impact on childhood. And the next one, please. Indigenous people poisoned by pesticides. So proportionally, indigenous people are the ethnic most affected by pesticides in Brazil. So there is, we could stop the sharing my slides, sharing my screen now. So I would like to say that there is a huge asymmetry also when we are talking about who have been impacted by pesticides. I would say the indigenous people, the peasants, and among them the women and children. So we have what have been done in Brazil in terms of this subject. I would like to mention among many initiatives. I would like to highlight the importance of the National Forum Against Pesticides, which brings together public ministry, scientists, and representatives from civil society organizations. Among the achievements, I would like to highlight that the forum has raised the awareness about the subject on the whole country, has demanded the transparency from government regarding the data, has demanded the phase out of HHPs, and particularly atrazine is on the table. And it was done in the case of paraquat, carbendazine, and carbofuran, and has also advocating for the ban on aerial spraying, which was done in one of Brazilian states. Thank you so much for the invitation. I am available for further questions. Thank you, Ana Paula. Thank you so much.
Obrigada, Larissa. Thank you. Thank you for also highlighting the Brazil as a case study. I mean, I think it's telling when they say many of the panelists before you have talked about the double standards, but when we put numbers, figures of 10 pesticides most sold in Brazil, 4 are banned in the EU, that, I mean, with most of those being used in the Amazon region, which we already know is a very fragile and threatened ecosystem. I think that information speaks a lot. And then, and also like the 10, around approximately 2 million people intoxicated by pesticides, including babies, women, including pregnant women, indigenous peoples and peasants, in a space of 9-10 years. Thank you also for sharing the role of the National Forum for combating the impacts of pesticides. That could be used perhaps as a model in other countries where you have this space where government and civil society, grassroots movements can come together to discuss policy making. So thank you very much for this presentation and for all the work that you are doing on this important topic in Brazil. Now moving to our 7th speaker, Leah Utiasheva, is the Policy Director for the Center for Pesticide Suicide Prevention at the University of Edinburgh. Leah, your research has emphasized how certain narratives, such as blaming the farmer for the misuse of pesticides, have worked against pesticide management and regulations that protect human rights. Can you give us other examples of those narratives, and which are, in your opinion, the main misconceptions to fight against for sound management of pesticides rooted in the protection of human rights? You have the floor.
Thank you very much, Anna. Can you see my slides?
Yes, we can. Yes.
One moment. Yes, indeed. I will jump straight to answering your question. Anna, I would like to address several misconceptions or myths of pesticide management that I think stand in the way of successful human rights approach to pesticide management. The first of them is that intentional pesticide poisoning is blamed on people who poison themselves with pesticides. It is said that it is a misuse of pesticides and it should be excluded from the protection at the international fora and by the international organizations. And the second associated with this misconception is that farmers should stop misusing pesticides. They are to blame for misuse. And if only farmers knew how to use pesticides responsibly, there would be no harm to health and the environment. Indeed, intentional pesticide poisoning and misuse of pesticides is specifically excluded from the protection of the Rotterdam Convention. It is mentioned in several places that intentional misuse is not in itself an adequate reason to list a chemical in Annex 3. And generally, misuse or intentional poisoning with pesticides usually is separated from occupational and accidental poisoning and deserves less protection, less attention. However, I would like to remind people that out of 720 suicides every year, about 1/3 or more perhaps of all suicides are due to pesticide self-poisoning. and over 100,000 deaths every year happen due to this means of pesticide poisoning, due to this means of suicide. There are several nuances here that make this poisoning and this method of suicide different. Suicides are usually impulsive and they're rarely associated with mental health issues. This means that those suicides are very easy to, not very easy, but easier to prevent than other suicides because there's rare means substitution. That means that if people will survive their suicide attempt, they rarely go on to attempt it again, to try to kill themselves with other means. And that really makes it a low-hanging fruit of suicide prevention, because if toxic means of poisoning of suicide are removed from easy availability, then these people would just survive and lead productive lives. So it is probably should be pointed out that it is a state obligation, government obligation to prevent suicide, and it is also a human rights obligation. Here I have a quote from the general comment number 36 that states that a government should take adequate measures to prevent suicide, especially among individuals in vulnerable situations. And similarly, here is another quote from the Human Rights Committee that mentions along the same lines that vulnerable people should be protected from suicide. And it has been mentioned before that the UN Declaration on the Rights of Peasants, that smallholder farmers and people living in and working in rural areas are indeed among the most vulnerable groups in the world. So hopefully this shows that intentional poisoning should not be excluded from international protection, and people do have a right to be protected, their lives and their health should be protected from intentional poisoning. However, pesticide misuse is a much broader term than only intentional poisonings. It could be anything. It usually is defined very broadly or not defined at all, and it's overuse and over application of pesticides, using for wrong pest or use without the PPE and so on. Generally, any use of any pesticide use that can lead to health or environmental harm may be blamed on misuse of pesticides. And of course, this narrative is very harmful because it does point to the good guys, the industry who do everything that is in their power to protect farmers and food security, and the bad guys, the users who fail to use pesticides safely, who don't know how to use it. And it also creates a narrative that users are ignorant, farmers are ignorant, and if only they knew how to use pesticides responsibly, then there would be no harm to health. This is, of course, in reality is not the case. There is a multitude of reasons, structural individual factors that make following instructions on pesticide use impossible in real life situations. And it is pointed in research that in order to follow the rules, the safety rules, farmers and agricultural workers need not only to know about the dangers, but also need to be able to follow the rules. And there are multiple reasons in real life situations why farmers and agricultural workers cannot follow these rules on the use and use pesticides according to instructions. Here I point to the human rights that specifically affected by the unequal situation between farmers and the industry, and this narrative that blames farmers for misuse and generally health and environmental effect of harm associated with pesticides. Mostly I would like to point the non-discrimination part of this, because as I mentioned, this mostly affects people in low-income agricultural communities, and those people, because those people belong to most vulnerable groups. This makes a case for protection of equality and non-discrimination in human rights. Here I have, this is my last slide. I have several action points that I would like to point out very quickly. it needs to be recognized that certain pesticides are just too toxic to be used by smallholder farmers and farm workers in low and middle income countries, and that the focus of the implementation of the code of conduct should be on elimination and substitution of those highly hazardous pesticides, not on safe use trainings. The second one is occupational, intentional, and unintentional poisoning should be treated equally and should be understood as a consequence of wide pesticide availability and use. And people should not be blamed for intentional poisonings with pesticides. And the third one is that the concepts of safe use and misuse of pesticides should be eliminated from policy, legislation, and research for the protection of human rights. Thank you very much.
Thank you so much. Thank you so much, Leah, for addressing the misconceptions, the misconceptions about pesticides and how those myths are actual barriers for improving human rights protection, including against intentional poisoning. And who are the most affected? Farmers, peasants, and I think this is a point that has been reiterated by all speakers so far. Thank you also for sharing those 6 action points for HRBA to pesticide management. I'm not going to attempt to summarize them here now, but all the presentations are going to be available at the Geneva Environment Network website for those that would like to take more time to observe those recommendations. So thank you very much, Leah.
Thank you.
I'm now moving to our 8th speaker, Paulina Nikkanen-Rettaroli, who is the Senior Technical Lead and Unit Head on Human Rights at the World Health Organization. Paulina, prolonged pesticide exposure threatens the right to health, particularly for agricultural workers, children, pregnant women, and people in vulnerable situations. Can you give us examples of the risks based on evidence of what concrete policy measures would most effectively protect those in most vulnerable situations from these toxic risks? You have the floor.
Thank you very much, Ana Paula, and good afternoon, everyone. You asked specifically about the impacts of prolonged pesticide exposure on the right to health. I was first going to mention some of the immediate risks, such as pesticide poisoning and suicide, but these were already covered by the previous speaker. So let me just reiterate that these immediate risks also need to be managed to protect the right to health. As for the health impacts of prolonged pesticide exposure, longer-term exposure has been linked to many different health problems, such as cancers and neurological and immunological disorders and developmental problems in children, as well as to health effects to liver, kidneys, lungs, cardiovascular system, the gastrointestinal tract, and reproduction. So there's really a broad range of health impacts. Some people are, of course, more vulnerable than others to these impacts. For example, children are more vulnerable than adults, and pregnant women who are exposed to pesticides are at higher risk of miscarriage, preterm delivery, and birth defects. Farm workers, as many others have mentioned, are obviously more affected, but even among farm workers, often those who are already in vulnerable situations, such as migrant and temporary workers and small-scale farmers and their families, are the most impacted because they may lack literacy skills to understand the risk and may have limited access to health services. So what does this mean for policy measures? I'm very much in line with all the previous speakers on what is needed. First of all, as many others have already said, there should be a recognition that some pesticides are just too toxic and should be banned everywhere because the risks to health and human rights are just too big. There also needs to be a recognition that being serious about human rights means getting into the nitty-gritty of how things are done at very local levels. There needs to be concrete action in those places where people live and work and go about their lives, so human rights are meaningful. This means, for example, that people whose health may be negatively affected by pesticide use must be able to participate in decision-making so that their needs and perspective inform pesticide management. It is also not enough to provide information about the risks, but governments need to ensure that all individuals, regardless of their literacy levels, have access to understandable information about pesticide risks, and that also they are equipped to use this information to safeguard their health. So I'm very much in line with what other speakers have already said. I'm also in line with others on another concrete action that is needed, which is strengthening of accountability mechanism across the board. At the health sector level, countries should be putting in place mechanisms to track pesticide exposure and health outcomes and other impacts on health. Within other sectors, there is a need for regulatory frameworks that compel pesticide manufacturers and agricultural businesses to prioritize health over profit. Since private corporations do not have direct legal obligations under international human rights law, the onus is really on governments to ensure that appropriate legislation and regulations are in place to ensure the accountability of private actors. And us within the UN system have the responsibility to support countries in putting those in place. There is evidence, as Ana Maria already talked about, that pesticide industry is using similar practices as other health-harming industries, such as tobacco, unhealthy food and beverage, and fossil fuel industries, to influence scientific and regulatory processes to maximize commercial gain at the expense of public health. There should therefore be mechanisms to ensure that the industry cannot have undue influence on public policies. And I take the opportunity here to mention that the forthcoming report by WHO on commercial determinants of health will highlight the role of pesticides industry on health. Finally, as others have also mentioned, to ensure accountability, there should be accessible mechanisms that allow people and communities to seek and obtain redress for health harms caused by pesticides. I stop here, but I look forward to further discussions on how we can collectively promote a rights-based approach to pesticide management. Thank you.
Thank you. Thank you very much, Paulina. I think we could nearly write a new code of conduct based on all the recommendations and points and action points being presented through all the different panelists today. I think you managed somehow to also tie it very well and summarize in line with what other speakers have said. What are the necessary policy measures that are needed to including, for example, the recognition that some pesticides are too toxic and need to be banned, the concrete action that is needed at the local level, meaning that those with their health impacted by pesticides, they need to be able to inform measures, and they also they need that information needs to be communicated in an accessible way and be used. And they should be able to also use this information to protect their lives. Accountability mechanism, there was another point that you have raised, including mechanisms to track pesticide exposure, regulatory frameworks that compel business to prioritize health over profit, also highlighting that the industry should not and cannot have undue influence over those processes. You've also mentioned the long list of health impacts related to the immediate and prolonged risks of pesticides, mentioning as well that children are more vulnerable than adults. Pregnant women's risks are very high to exposure, and also how farm workers, but even particularly within this group of migrants, temporary workers, and small-scale farmers are also more at risk or most vulnerable to negative impacts of pesticides. Thank you very much, Paulina, for sharing these perspectives with us here today. Our ninth speaker is Rochelle Diver. She's the UN Environmental Treaties Coordination and International Indian Treaty Council Rochelle, I know you, and I know that you like to introduce yourself. So I'm not going to do this on your behalf. I will let you do this and on your own way. But I do have a question for you. And Indigenous peoples are entitled to both collective and individual rights, which are all human rights. How should the code be amended to duly incorporate the free, prior, and informed consent of Indigenous peoples? And how does this collective rights of a procedural nature relate to the substantive and individual rights of Indigenous peoples? You have the floor.
Many thanks, Ana Paula. I really appreciate it. Yes, I will go ahead and introduce myself. Oh, and also start my timer. Very mindful of time here. So, Buju, Minogijigab, good morning, good evening, good afternoon to everybody. My name is Rochelle Diver. I'm Anishinaabe. We are peoples located in the Great Lakes region of the US and Canada. And I just want to mention two other hats that I wear that are relevant here, which is on the International Planning Committee for Food Sovereignty, the Fisheries Working Group, the IPC Fisheries Working Group. I'm also honored to be one of the two Indigenous representatives on the CSIPM, Civil Society and Indigenous Peoples Mechanism for Relations with the Committee on Food Security. Thanks again, Ana Paula. It's really an honor to be here and to join this conversation today. And thank you to the Geneva Network for putting together this distinguished panel. And the question is very well worded. Indigenous rights are human rights. They're also cultural rights, the right to food sovereignty, including our right to maintain and control our own Indigenous food systems and ecosystems. The full realization of Indigenous rights, which are based on the Indigenous worldview in regard to respect, meaningful stewardship, and our responsibility to the next 7 generations, which is the most important attribute of all of this. This is how our collective rights procedurally relate to individual rights of Indigenous peoples. To us, they cannot be separated. Gains and victories for us collectively support our commitments to communities and our health and well-being. This includes the right to FPIC, but also self-determination is very key here. So those are the two principles that we're really trying to push forward as we work to contribute to amending the Pesticide Code of Conduct. I believe I have some slides. Yes, there are just a few here. They're very heavily worded because it's meant to share, but it'll show the long journey that Indigenous peoples have been on to try to keep pesticides out of our communities and ecosystems and food systems. So this is 2003, where that's when IATC began to document the impacts pesticides were having, in particular on the Yaqui community in Sonora, Mexico. Next slide, please. In 2008, there was both a special rapporteur and a doctor, Elizabeth Guillet, that went into the Yaqui communities to begin to document this, the pesticide impacts that were happening. These children that are shown here were born with severe developmental disabilities, with a term that they use called jelly babies in regards to their bones not completely developing. And they saw a number of impacts, and these were directly related to the aerial spraying of pesticides in their community. They were even able to retrieve one of the canisters that fell out of the plane. And at that time, that canister was Bayer Crop Science. Next slide, please. This is what we've been using for many years to show the impacts that these pesticides have been having on children. Look at the difference between the valley where the pesticides were being sprayed, and of course in valleys they then stay closer to the environment, compared to the children in the foothills. They were able to articulate better, both with words and through drawing. So this was, very important for our fight to show. They always say there's no correlation. I don't think that these results can be ignored. It's a very short time that I have. Of course, this study and the impacts are much more detailed, and I'm so happy to share that with everybody in the chat and with the Geneva Network to put on the webpage. Next slide, please. So at first we were told the Rotterdam Convention was the place that we address this loophole, right? That the other panelists have mentioned about allowing states to import pesticides that are banned in the countries that are exporting them with prior and informed consent. And that goes to this: just because something is not illegal, it may still be immoral. So we were trying to use the BRS conventions for a few years to try to work towards this change. But we were instructed by the FAO Pesticide Unit in 2017 to begin engagement with the Pesticide Code of Conduct to try to make this important change. Next slide, please. We worked with many UN bodies, not just in the human rights arena and not just at FAO or UNEP. It was brought in 2015 to the Convention on the Rights of the Child, where these pesticide impacts were well documented. And this was with the review of Mexico. And there was a very strong recommendation that came out to halt the import of these pesticides. This was monumentous for all of us in the world, right? What we're fighting for are Indigenous rights. Indigenous rights are human rights, and that's a clean and healthy environment for all of us, but most importantly, our future generations. Next slide. The Permanent Forum on Indigenous Issues also gave us a wonderful recommendation that was really detailed and that we were able to use to begin engagement with FAO on this matter. And we worked very closely at that time with Special Rapporteur on Human Rights and Toxics, Baskut Tunka. Next slide, please. And I'm wrapping up here. This brings us now to the current 2022 recommendation that came from the Permanent Forum. I'm calling on FAO and the World Health Organization to amend the International Code of Conduct to take into consideration the free, prior, and informed consent of Indigenous peoples. But of course, we hope to see all of our rights that are encompassed in the United Nations Declaration on the Rights of Indigenous Peoples to be taken into consideration here, as well as strong human rights language. So Treaty Council is working very closely with the Pesticide Unit of FAO, with the Right to Food Office and that strong team that's there, and the Indigenous Peoples Unit to hopefully get another recommendation coming out of the Permanent Forum this year, which will be taking place in 2 weeks in New York City, to then continue on this journey with the support of these different UN bodies. You can go to the final slide while I say my thank yous. I appreciate everyone's time. You know, we really, a lot of information to put into a small presentation. So I apologize if I was going through it quite quickly. I'm available for questions and to share any materials that might be helpful to everyone else on this call. Chimigwech, many thanks to everybody.
Thank you, Rochelle. We really appreciate you sharing with us the deadly impacts on Indigenous women, children, and unborn generations. I think was the first time we mentioned here the impacts on unborn generations, illustrated through the impacts of pesticides in the lives of the Yaqui women, and also for leading the way for over a decade and more as Indigenous peoples that have led to a review, to opening the process of a review of the WHO and FAO Code of Conduct. A review that we hope will be more grounded in human rights, including in the free, prior, and informed consent of Indigenous people. So thank you. Our 10th speaker is Iago Wadley, who is the International Advocacy Manager at Pesticide Action Network UK, where he leads the organization's engagement in international and UN policy frameworks and forums relevant to pesticides. Iago, the Pesticide Action Network has played a pivotal role in exposing and documenting the links between pesticide use and human rights violations. Drawing from PAN's extensive experience, could you share some specific cases where pesticides have directly impacted human rights? The floor is yours. And we cannot hear you.
Sorry, thank you very much. Can you hear me now?
Yes.
Yeah, so I hope I'm going to answer your questions. I'm also going to talk about the rights and wrongs of the Code of Conduct specifically, and make some recommendations about that. I think I have to, here we go. Right, so yeah, I just want to summarize the kind of rights that we're talking about. So pesticides affect and are relevant to the right to life, to adequate food, as we've heard, the highest attainable standard of health, a clean, healthy and sustainable environment, clean and safe drinking water and sanitation, and just and favorable conditions at work. And there are other rights that are relevant in this sector. But I think our view is that ultimately billions of people are having probably one or more of these rights violated every year due to pesticide policies, practices, and the pollution involved in the widespread intentional use of pesticides. And on the right of the slide here, I've put some headlines from studies and articles around some of the human rights and health and environmental impacts of pesticides. You know, PAN UK runs an acute pesticide poisoning monitoring app that we conduct in conjunction with organizations like FAO and national governments to survey farmers on pesticide poisonings around the world. We have one of the biggest data sets in the world on acute pesticide poisoning. And I believe on average about 44% of farmers that we have surveyed across numerous countries have expressed that how they have suffered acute pesticide poisoning in the last year due to pesticide use. So, you know, they're a very exposed community to acute pesticide poisoning. But, you know, farmers are actually 27% of the global workforce. The vast majority of global citizens are also affected and having their rights affected through often chronic exposure and chronic health impacts and environmental impacts. You know, pesticides are in our blood, our urine, our sperm, our placentas. You know, nobody is choosing this. Nobody is saying, yes, I agree to have pesticides in the environment, in the food around me to such a degree that I am systematically polluted by pesticides. You know, nobody has given consent to that. So, you know, this is the scale of rights abuses and violations that are happening day in, day out globally due to pesticides and negligence in their management. So where does the Code of Conduct sit on human rights? I mean, there is no mention of human rights or Indigenous peoples' rights in the Code of Conduct. And in fact, the only reference to rights is, unfortunately, the FAO's copyright. And what is the objective? The objective of the Code of Conduct, the first one is to establish voluntary standards of conduct for all public and private entities. And in many ways, this sort of structurally subverts and replaces the concept that we've heard about from other speakers of human rights obligations of nations and companies. These are not voluntary codes, these are obligations. And to promulgate the objective of a code that ignores those is deficient. You know, the code does not reference or refer to any international policy framework relevant to human rights. And that is in effect the exclusion of rights by omission at a structural level in the code. So we do believe rights need to be reflected in the code and in its annex. And we're glad and acknowledge the role of organizations like IITC in prompting this discussion and the opportunity to amend the code. So I'm just going to recommend some reforms for the code. We're not going to get down to detail, there's no time here, but look at some principles that we think need to be in play when the code is revised. And we think it needs to be quite a surgical exercise. We are very mindful that there are valuable things in the code, albeit is a voluntary instrument, that we don't want to lose what is good in it. And so we are mindful that making surgical changes will be useful. But we think that the changes need to mandate that the observance of human rights and Indigenous rights is there, and it needs to emphasize that nothing in the code removes the obligations of states and companies to uphold human and Indigenous rights. We think it needs to emphasize the heightened obligations of governments and industry actors in upholding rights, but also in preventing harms all risks of harms and providing remedy for harms where they are identified. And we think it needs to cement the precautionary principle on human and environmental rights in national pesticide registration bodies and processes. So we need the code to cement the concept and practice of diligence rather than negligence. And then we'd like it also to integrate explicit reference to relevant human and indigenous rights instruments and standards. So many have been mentioned today: UNDROP, UNDRIP, some of the private sector human rights due diligence standards would be well mentioned in the annex or the code. And we also think it should mention, as some speakers have mentioned, the preference for phasing out, the objective of phasing out the most highly hazardous pesticides whose use cannot really be safely undertaken in many countries. And so for that reason, we would recommend that it explicitly reference the global framework on chemicals and other mechanisms and policy instruments that call for the phase out of highly hazardous pesticides and for the better regulation of trade on banned pesticides. But again, we hope that this process will not be seen as opening a door by some parties to weaken what is already in the code, and that the process can truly strengthen it rather than be seen as a chance to weaken it further. So that's broadly it from me. Thank you very much.
Thank you very much, Iago. Thank you for showing, reminding again, emphasizing how human rights are violated through pesticides policies, practices, and pollution on a daily basis, affecting billions and billions, virtually all lives, some more than others, though. The lack of reference to any mention of rights at the code of conduct, and also for highlighting how a code based on a voluntary conduct disregard the obligations that are already in place that impose the duty on states to respect, protect, and fulfill human rights. Also appreciate how carefully you put forward the surgical recommended reforms to strengthen the code of conduct by more explicit referencing the precautionary principles, human rights obligations to uphold rights, but also reference to human rights instruments like the UN Guiding Principles on Business and Human Rights, the UNDRIP, UNDROP, and so on. Really appreciate that. Our next speaker, and Frederick, more than ever, we will need you to be very, very concise on your presentation. You still have your 5 minutes, and I ask everybody here to bear with us for an extra 5 to 7 minutes, and I think we'll be done just before 3:40. So Frederick Otieno is, last but not least, our last speaker, and he's a program officer at the Center for Environmental Justice and Development, CEJAD, where he leads implementation of projects on pesticide risk reduction, working with communities and policymakers in Kenya. Frederick, the Center for Environmental Justice and Development works with communities affected by toxic pollution to limit exposures and advocate for policy change. Based on your grassroots experience, how are communities affected by pesticides, and which measures are needed to strengthen social accountability on the impacts of pesticides on human rights and access to justice in case of violations? You have the floor.
Thank you, Anna, for the question. I think I'll start by saying that in terms of how pesticides impact communities, much of the things have already been mentioned by the previous speakers, but allow me to just give an experience of what we did last year and what we have been able to see from that. So last year, we commissioned community monitoring of pesticides impacts in 3 regions in Kenya. And during this process, we basically formed 3 different teams composed of community leaders and farmers. And we're trying to train them on how to use community pesticide action monitoring. During this process, we asked them to share experiences in terms of how pesticides have impacted them. And we were shocked to listen to about 10 witness accounts of how pesticides have impacted workers, particularly in the flower farming sector, but also small-scale farmers. And we heard of stories of women, for example, who have had miscarriages as a result of exposure to pesticides. They were able to tie this, to their use of pesticides and the occupation that they were in. And so what we've seen is that, yes, we don't have this kind of information in many countries, but this information is with communities. And what is needed here is just to collect this information so that we are able to be able to understand how pesticides are impacting communities. So I just want to share that short experience and not go into the details. But what we have also seen in Kenya, for example, are communities who've complained of lack of honeybees to be able to pollinate their crops, and therefore they have been forced to physically pollinate their crops. And that shows how pesticides can impact communities so many ways, but I won't go into that. Much of it has been said. So allow me to spend my time in trying to answer the second part of my question, second part of your question, on how we can strengthen social accountability on the impact of pesticides. Allow me to start by reflecting on something that I think is a weakness, especially in low and middle income countries, is the evidence. We've made people doing a lot of monitoring, but we don't have a central place where this information, for example, can be accessed, and that this information can be able to inform decision making. So I think this is one thing that is needed. We can't call for accountability when we don't know. So I think we need this information, and therefore countries need to invest on community monitoring, for example, of health effects, but also environmental effects. But more importantly, we need to actually encourage independent monitoring by communities, but also independent monitoring by civil society organizations and other like-minded organizations. This is important because what we are seeing currently is a lot of baseless industry narratives that have actually continued to encourage the use of toxic pesticides. So without this, I believe we are not able to call for accountability. The other important element that I want to reflect on in terms of strategy is how do we counter the growing industry influence? And I'm glad the previous speakers already reflected on this. This is something that is actually impacting a lot on accountability, particularly in low and middle income countries. And so we need strategies to be able to counter this. And one important element to this fight, I believe, is how do we make community voices matter? Because this has been totally lacking in most of our countries where industry have had a lot of influence on regulation and also on our regulators. So I believe if we empower communities to be able to call for accountability and call on their governments, call on the industry to be able to stop, for example, sale of toxic products. This is one way we can be able to actually strengthen these aspects. And also, how do we empower communities to be able to call for this? I believe it's important to be able to involve communities in monitoring also efforts so that they're able to understand how they're impacted, they're able to understand the effects, they're able to collect evidence, and they're able to share this. So I believe that is very important. The other element that is important in countering this industry influence is the whole issue of we need to call out cases, instances of unhealthy relationship between pesticide regulators and the industry. This is a common problem in most of our countries that can only be solved by us constantly calling this out so that we are able to stop such kind of toxic or unhealthy relationship that has led to the regulators being taken or being captured in terms of making pro-people policies or pro-environment policies to policies that actually, as someone already pointed out, prioritize profits before people. The other element that I feel is important is how do we provide access to justice for communities and vulnerable groups that have been impacted by pesticides. Again, in our experience, we've listened to many cases of people who've been poisoned who are suffering from pesticide exposure, but they don't have an avenue where they can report this, but also an avenue how they can access to justice. So I believe we need to find ways of providing legal support and legal aid for communities that are and victims of pesticide exposure to be able to demand and call for accountability. The last important bit is the law. I wanted to reflect briefly on the law and start by ensuring that the law in our countries reflects these fundamental human rights. As Diego said, most of our laws don't have this kind of reference. So we need the pesticide laws, for example, to reflect or have this kind of reference That's a starting point. Also, what have been spoken about before is our laws should not allow importation and use or registration of products that have been banned in other countries, should not allow the use of and registration of toxic pesticides or highly hazardous pesticides, but more importantly, the law should provide for measures for ensuring transparency and accountability on the part of the industry. I feel these are very important steps and very important strategies that can help us to be able to strengthen these aspects of accountability in our countries. Thank you so much, and I want to stop at that.
Thank you so much, Frederick. We are a little bit over time. I just wanted before, I mean, we were not going to have a chance to go through our speakers for final remarks, but just want to acknowledge a few comments that are coming from those in the audience, and they are very interesting, and I think in line with what has been discussed and touched upon by all the panelists, including on the lack of financial resources to enforce pesticide management policies, the regulatory asymmetries between global north and global south concerning double standards, and the need to strengthen institutional capacities of importing countries to hold agrochemical industries accountable and promote sustainable alternatives, the role of agroecology on this, and also food security, how pesticides are impacting food security, increasing debts of farmers, but also on the impact of pesticides on soil. There was finally a question that I hope maybe if you have time, Rochelle, to answer on the chat about the review of the code of conduct, if from your perspective it should be restricted to indigenous peoples or expanded further to encompass human rights. It's a shame that we don't have more time for an interaction, but before saying goodbye to you all, this event was co-organized also with Jen, and unfortunately the special rapporteur had to leave at 9:30 his time, 3:30 my time on the clock, but we also co-organized by FAO. So I will just with the last 2 minutes that we have of your extra time, to invite Juan Jose to share some final words, and with that we pass the baton to Diana for final announcements. So Juan, if you want to do the honors.
Thank you so much, Anna. Indeed, it has been many speakers, 11 speakers, but I believe that everyone really appreciates the weight, the deep, the consistency of the messages, right? Which is really interesting. I mean, we have been talking on behalf of different UN organizations, also civil society, different sectors and aspects of the civil society, and I think the message is loud and it's clear. Which is that pesticides pose a threat to human rights in various ways, in many directions, whether we look into indigenous peoples' rights, whether we look into the right to food, whether we look into the right to health, or UNDROP and the rights of peasants and communities, right? So I think the message is clear and loud. I think there is also opportunities ahead of us to keep advocating for changes, for protection of the human rights of the people affected by pesticides. Indeed, the reform of the Code of Conduct on Pesticides Management would be one if only the Committee on Agriculture could make sure that there is a mandate to do that, because right now that mandate it's quite restricted, I should say. It's basically in terms of free, prior, and informed consent. That is right now what the COAC was asking for. I really wish personally the Code of Conduct could be reviewed much widely. As I mentioned in my intervention, there are other venues, other possibilities ahead of us for advocating for this. I think some of us also, really wish for one day where there would be binding treaty on transnational corporations would also include pesticides management. So there are ways to keep moving forward. The evidence is there. There has been incredible evidence put forward in Brazil, in Africa, and elsewhere that we can be mindful, and we should be mindful about. We are talking about concrete people, concrete communities' lives. So I think with this we can really end. And thank you again to all the panelists. Thank you to all the organizers. And of course, to the participants that have been with us for this long, but I hope fruitful conversation. Thank you.
Thank you all. Thank you also to you, Juan, and to you, Ana Paula. Just wanted to bring to your attention that next week we will have 2 more sessions in this series. One that will look at plastic waste exports, and the second one that will be the general briefing that we're organizing with the Secretariat with the final instructions for the conference of the parties before we welcome you all in Geneva for these important meetings. Also reminding you that the video of this event is available on the page of this event. I think there were, as you mentioned, Juan and Ana Paula, very important messages shared, all converging in the same direction, and it's important that this goes further. So don't hesitate to share the link to the video, the link to the page, where you will also later find the summary of the event to those who were not able to join us here at this time. So with that, thank you all, and see you soon.